Hey guys, welcome back to my YouTube channel. Hope you have been doing great. In today's video, I'll be talking about pre-eclampsia, eclampsia, and the magnesium sulfate protocol. So let's dive straight into today's video or today's topic. So what is pre-eclampsia? Pre-eclampsia is a condition in pregnancy, not a good one, which is characterized by hypertension and significant proteinuria presenting after the 20th week of pregnancy or the 20th week of gestation. Now let's move to those factors that can put every pregnant woman at risk of having pre-eclampsia. I'll be sharing 4 common factors with you guys today. So the first factor that can put a woman at risk of experiencing pre-eclampsia is a previous history of pre-eclampsia. That's a woman who had pre-eclampsia in her previous pregnancy. There is a high chance that she can have it in her current or subsequent pregnancies. And I'm talking out of experience. I've had cases where ladies have had pre-eclampsias in their pregnancies, maybe twice or thrice. I've had cases like that actually. And the second factor that can also put a pregnant woman at risk of having pre-eclampsia is multiple pregnancy. That's ladies who are carrying twins, triplets, or quadruplets or more. These ladies are also at risk of developing pre-eclampsia. And the third factor is first pregnancy or primigravidas. As women who are pregnant for the first time also have a chance or are at risk of having pre-eclampsia. And the last but not the least factor is a pre-existing history of hypertension and or diabetes. So guys, these are the common factors that can put pregnant women at risk of developing this obstetric complication known as pre-eclampsia. And research have shown that pregnant women who have one or more of these symptoms, it is very advisable to place them on aspirin 75 milligrams daily beginning from the 12 weeks of pregnancy, because this is going to help prevent blood clots and subsequent eclamptic seizures. So it's very important for these women to be induced on aspirin 75 milligrams daily beginning from the 12 weeks of pregnancy. This is going to help prevent further complications and may even help prevent the complication called pre-eclampsia in their current or subsequent pregnancies. And now let's talk about those common symptoms of pre-eclampsia. There are 3 common symptoms of pre-eclampsia. The first one is hypertension, indicated by a blood pressure greater than or equal to 140 on 90 millimeters of mercury that has been taken in 2 occasions 4 hours apart. And the second factor is significant proteinuria. Significant proteinuria is defined as a 24-hour urine collection that reveals a protein level of at least 300 milligrams per deciliter, or at least protein plus 3. And the third factor is edema. Normally with pregnancy, edema around the ankles is very common. This might even get lost overnight, but when you start noticing edema, especially pitting edema at your tibia, that's your shin bone, or you start noticing on your face, your hands, your abdomen, and your sacrum, then those are signs that need to call your attention, or those are signs that need to prompt you as a pregnant woman to go to the hospital for consultation. And the truth about tackling pre-eclampsia is that we all have to work as a team. Because in the health system, when we talk about team efforts, it's not just about the doctors and the nurses, or between the doctors and the nurses. The patients are also involved in that team. Because if you, the patients, don't cooperate, we can't render care to you effectively. So patients are all part of the team. So the reason I'm saying this is because a midwife might see some symptoms during antenatal clinics that may be leading to pre-eclampsia, or that may be indicating that this lady might be at risk of pre-eclampsia. And she may want you to run some further tests like maybe get a urine test and so on. So you as the pregnant woman who thinks she's not feeling unwell might hesitate to do or follow the midwife's instructions. So what I'm trying to say is that you need to trust your midwives, you need to listen to them, because what they want is the best for you and your baby. They want to make that journey at that stage in your life a beautiful and memorable one. So patients or pregnant women, please try and listen to your doctors, your midwives, your nurses. They are there to help you. So guys, this is a very important aspect in the health field: teamwork. Teamwork is really important. Trust me guys, we can render care effectively if teamwork is not in place. Now let's talk about the common types of pre-eclampsia. We have three types of pre-eclampsia. We have the mild or the you can say it's a mild pre-eclampsia. The mild pre-eclampsia is characterized by a blood pressure ranging from 140 on 90 millimeters of mercury to 149 on 99 millimeters of mercury, and it's also characterized by a proton level of +1, which is equivalent to about 30 milligrams of proton. That's milligrams per deciliter of proton. And for moderate pre-eclampsia, it is characterized by a blood pressure ranging from 150 on 90 millimeters of mercury to 159 on 109 millimeters of mercury, characterized by a proton level of +2. That's or is equivalent to a proton level ranging from 100 to 300 milligrams per deciliter of proton. And the third type of pre-eclampsia is severe pre-eclampsia, which is characterized by a blood pressure greater than or equal to 160 on 110 millimeters of mercury, and is also characterized by a proton level of 300 milligrams per deciliter of proton, or proton +3. So guys, these are the types of pre-eclampsia. And for the treatment of pre-eclampsia, it's very important for you all to know that the first line of treatment for all these types of pre-eclampsia is antihypertensive medications. These medications are simply given to regularize the blood pressure. And it's also important for you all to know that pre-eclampsia has a cure. And the cure of pre-eclampsia is delivery of the baby and delivery of the placenta. Yes, this has been proven with research. It has been proven that most women who give birth, that's women who have been diagnosed with pre-eclampsia and they give birth probably due to induction or a planned cesarean section, this often remedies the situation. So actually, what will happen is that when a woman is diagnosed with pre-eclampsia, let me say mild pre-eclampsia for example, with mild pre-eclampsia, what the doctor will do is that a doctor will try to regularize your blood pressure and then program you for delivery, at least at the 37 weeks of gestation. That's the doctor is going to program you for delivery, maybe by induction or maybe a planned cesarean section from the 37 weeks of gestation. But for moderate pre-eclampsia, an induction or a delivery can be planned from the 34 to the 36 weeks of pregnancy. But for severe pre-eclampsia, an induction or a delivery can be planned from the 34th week of pregnancy. But in rare cases where the blood pressure is uncontrollable, that's everything has been done, but the symptoms keep worsening, early cesarean section may be done as early as 28 weeks of pregnancy to save the life of both the mother and the baby. So guys, this is what is being done to manage or to remedy pre-eclampsia. So it's very important also as a midwife for you to be conscious about some certain signs that may predispose a woman to having eclampsia. Now this takes me now to what pre-eclampsia is all about. So what is eclampsia? Eclampsia is a neurological condition that's associated with pre-eclampsia. and is characterized by what we call tonic-clonic convulsions. As you actually see a patient seizing seizing violently or aggressively. You see their muscles are stiff and they are just trembling in front of you. That's an eclamptic seizure. Guys, let me tell you an experience. There was a lady that came into the maternity at one fateful night shift. I was the one on duty, and she came complaining of headache, epigastric pains, and some sort of numbness that she could not feel her left arm really well. So by the time I was done taking her blood pressure, that lady started seizing. And I remember her blood pressure was around 168 on 120 millimeters of mercury. So she immediately went into seizures. A pregnant woman, of course. So that was already an eclamptic seizure. So it was later that I had to set up an IV line and start administering the magnesium sulphate protocol. Now, this takes me to the magnesium sulphate protocol. Magnesium sulphate protocol is a protocol that is being done in the health field, especially in obstetric, to manage or to prevent eclamptic seizures. This is where the magnesium sulphate protocol comes in. So for the magnesium sulphate protocol, what is being done is that this lady needs to have an IV line secured. And the magnesium sulphate protocol has been divided into the maintenance dose and the loading dose. For the loading dose, you give 4 grams of the magnesium intravenously. Magnesium sulphate, sometimes it comes in a powder form that you need to dilute, but some come in ampoules that have already been diluted and in ampoules. So you give 4 grams IV slowly over 3 to 5 minutes. As you give 4 grams IV for the loading dose, give 4 grams IV, and then when you're done with that, you give 5 grams on each buttocks. That means you give 5 grams on the left buttocks and 5 grams on the right buttocks. That's the loading dose for the magnesium sulphate protocol. So you give a total of at least 14 grams. And now you commence the maintenance dose 4 hours after the loading dose. And in order to keep going with the maintenance dose, you have to administer 5 grams on each buttocks every 4 hours. 5 grams on alternate buttocks every 4 hours. That means you give 5 grams on this buttocks, and after 4 hours, you give 5 grams on the next buttocks. 4 hourly times 24 hours. That's the magnesium sulphate protocol. It's really going to go a long way to help prevent these eclamptic seizures. So guys, this topic called pre-eclampsia, eclampsia, and the magnesium sulphate protocol is a very important topic that midwives and pregnant women need to be aware about. So I hope you guys share this video, and don't forget to comment below and tell me a topic you would like for me to do a video on, and I will do my best to make that happen. Please do not forget to subscribe. Subscribe guys, and turn on that bell icon so you won't miss any of my upcoming videos. This has been Boris the Midwife. Your health is my priority. I'll see you all in my next video.